Bijuda. Dr. Radha Ramanan. Dr. Biju John. Dr. Jain is here. വിളിച്ചാൽ മതി അല്ലയോ? ബിജുവിനാണ് വിളിക്കുന്നത്. ബിജു എവിടെ? ആരാണ് സാർ? Good morning, friends. So we will start a very serious issue, serious topic, that is medico-legal aspects. So last 1 year you have been listening to a lot of sessions on medico-legal aspects, and then this is the last of the program. I have great pleasure in inviting Dr. Radha Ramanan, our past president, Dr. Jain Chiman, incoming president, Dr. Biju John, general secretary, as vice counsel in this session. It is just an interactive session, sort of panel discussion sort of thing. Anybody can disrupt me anytime, and it is all about sharing your experience, and with that we will all improve our knowledge and then have a better chance of fighting a litigation. So that is the purpose of the whole session. So Dr. Biju John, and I have great pleasure in having Dr. Ashok Natarajan, LLB, to be part of my session. I will be talking, I am not a proper legal person, I will be talking on more of medical aspects of these legal formalities, and Ashok will be dealing with legal aspects more than medical. So this is titled FAQ in medico-legal cases. So first few slides I will show with some scenario, then we will have some discussion, and then we will go to Ashok's presentation. As part of KSOS President's project on improving legal literacy, I have conducted, with the help of Ashok and all, I have conducted more than 20 sessions across the state, and this will be a real world scenario. And we are releasing a book on consent book. This is a Malayala Samadapatram, Netra Shastrakriya Samadapatram. We will be releasing the book today in the inauguration, and it will be available for all the members from the website. You can modify this and then use it as consent in your hospital. So consent is the most important part of procedure. So Ashok Nataraj, KV Babu sir has not come. So first case is, I will give the most dreaded case that we all face is post-operative endophthalmitis. Okay, and this has the highest number of litigations. Naturally it has to be like that, because the patient has a disfigured eye. Whenever he looks at the mirror in the morning, he will curse you. So it is going to be a lifelong agony for the patient. So there is the maximum chance of litigations are in post-operative endophthalmitis. Few cases I will share, some of them. This was Najirul Sheikh versus Sumit Banerjee, 2024. In fact, the district council went against the doctor. The state and the National Consumer Redressal Forum was dismissed this plea, and finally the Supreme Court decision went against the doctor. So there are a lot of things that the Supreme Court is, they are very knowledgeable people sitting there. They will go through each and every aspect of treatment with expert opinion, and they will check all the documents, whether they have done all necessary tests, all standard procedure. So everything was taken, and then the case went against the doctor. Another case, this is State Consumer Redressal Forum versus Aravind Eye Hospital, way back in 2012. It was a CAM case, and the allegation was that pre-operative antibiotics were not given, which was well defended by the hospital, and the details of the sterilization procedure, this is important, were not produced in the court by the hospital, and unfortunately the expert witness at that time went against the hospital, saying that there was no need of cataract surgery and all. So all these 3 points we will discuss now. Okay, the compensation was awarded. So CAM case does not mean that you cannot be sued. Another case, Dr. Ramarao was a patient, And in that, the case went against Dr. Veeraya, who did the surgery. Patient, he has not advised B-scan, and the follow-up was not told properly to the patient. You come on this day and have a checkup. So it was not documented. So this is the problem. So here there are some points to discuss. If you get a letter from the patient or an advocate, there are two types of letter you can get in the, by a registered post. Whenever you get a registered post, you will be worried. So nowadays nobody sends registered post. So one patient and advocate. How will we respond to each one? I request Jain sir to give few thoughts about that. How will we reply to both of these?
The first letter you will be getting will be from the advocate saying...
Patient can also directly send you...
Patient can directly send the letter.
We are talking about notice that is sent initially. That's not a case, that's the initial stage notice.
It is not from the court. It is a letter, so and so. I request, you should pay this much.
Otherwise, I will go to court like that. Yeah. So notice, how do you reply to a notice?
That is the advocate notice. Advocate will be sending a notice to you. There are two ways to respond. One is you can just send a formal denial saying that you have given standard treatment and the patient was admitted, I had given standard treatment and there is no negligence on my part. That's all that is required for replying to an advocate notice. Or second is you can all give a detailed reply showing that, citing that you have done the correct thing.
So what do you prefer, Jimmy?
I prefer, and IMA's stand is always to give a formal denial report, not to divulge any details.
Important points. So there are some points in that. Actually, your letter should be strong enough without divulging all the finer details so that you don't lose. So whenever you give, I have done this.
One clarification regarding that. Anyway now we are going for the IMA. We are all having the IMA professional protection. So the standard procedure is to actually get their help, and let them draft the notice.
Yes,
right.
Drafting the notice.
Reply.
Drafting the notice. You can do either just blanket denial or with little details. See, there are two types of notice, I said. One is from the advocate or patient directly. Second is from the court when they ask for it. That time
is a
we have to
summons.
give the, that is a summons. You have to attend this with all the evidences. That should be
I think better not to give the whole details in the first one. Early
But
denial and some important thing.
valiant, strong points
Valiant,
so that
strong.
some cases may not go to the court at all. So that is it.
And as Bijusan said, the reply is always sent through the advocate only. We don't have to sit and write.
Don't write reply on your own. You have to go through the IMA PP scheme, and you have to sit down with the, whenever some notice comes, you take all the file or print out of all the files with consent form, all test, everything, and take a file and then go to the advocate, and then he will prepare he will go through the whole file, and then step by step you have to give a good reply when there is a summons.
So there is also one, other than this thing, sometimes especially in government hospitals, we get just complaints from the patient only, not through an advocate or anything.
That's my first point.
That I think we can...
that you can strongly deny, but you should give some data. Like I have done the standard of procedure, standard protocol was followed, something like that.
I think this situation, I think if with the patient alone coming, patient is coming directly, it is a communication thing. Actually, we have to communicate very well to the patient. And there only a denial is not good, because we have to convince the patient. That art will help the things.
Because notice is in the form of a legal format. And if you don't give a reply to the notice, finally when it goes to court, not giving a reply to court notice will be taken as a negative thing against the doctor. So that is very important.
So if the patient just writes a letter, don't give too much of details, but strongly deny. If the patient writes through the advocate, give little more strong denial, but don't divulge everything. Don't give all the investigation reports and everything. There will be some mistake, they will catch on that, and when you come to the court. Third one is summons from the hospital, means you have to properly. So these are the three things, differences in reply. Okay, how to formulate a reply. Please do sit with the patient, advocate, and go through each sentence word by word and then reply. That's very important. Don't allow the advocate just to give a reply on his own. You find time, it is your problem. So IMA schemes, Jane, you can highlight, all of you take IMA PP scheme and enhance the protection.
Yeah, that's what Mahesh said correctly. When you get a summons from the court, then you have to sit with the advocate and write a reply through the help of a PPS scheme advocate. Each word you have to specifically go through and give a detailed reply, because with that reply only your advocate is going to fight in court. You cannot change your statement in the court later on. So when you are replying to a court, it should be full. Each sentence, each word should be replied. That you have to sit with the advocate, get the help of PP scheme. And PP scheme is very much beneficial to all of us. Just paying 2,000 rupees per year, you get a benefit of 20 lakhs whenever you are covered up to Supreme Court. So we have an advocate in Supreme Court who charges, for one sitting he charges 1.5 lakhs. So you just by paying 2,000 per year, you can get the advocate through PP scheme. So that's the advantage.
And one thing about the reply, see, for a notice, there is not much of a time delay. I mean, whenever you want, you can reply because it's not coming through the court. Advocate is sending. But when you get a summons, the reply should be sent within 30 days and maximum 45 days. If it goes beyond that, the case will be decided ex parte. That means you will not be heard. Whatever patient says, the court will take into consideration and pass the decision. I had one gastroenterology friend, one day morning his friend called and told him, I heard your name on TV and they have awarded 50 lakhs damage against you. Then only he is seeing the TV and finding that, because he was working in some other hospital, the summons was given somewhere else and he has actually not received it. So that is very, very important. And most of the lawyers, they will tell you about this only 2 days before the last date.
Tomorrow is the
hearing, so you please send it today, like that. So, you know, you have to take interest in all these things. Lawyer will not come behind you. They are not like doctors who will go behind patients and ask things.
Regarding endophthalmitis, this scenario, you should submit all the details. Like I'll tell you the consent, written consent, then the full file, that full EMR or whatever printouts, then investigation, A scan, B scan, whatever you have done, even how many patients were operated that day, all other, that register copy, the NABH hospitals have that sticker, they sterilization protocols, all these things they stick in the register, copy of that, everything. Don't leave any loophole, so that others have not had any problem that they operated, same day operated. So these are all important when you submit. So it is your idea. I mean, judge, the advocate will not ask you bring that, you bring this. They don't know anything about it. They will just, so these are some of the ideas.
Though you are denying for the first letter, you should keep ready all these things when you get the first letter. Yeah. So because as he said, you won't get time to prepare detailed letter once you get a summons from the court.
This is what Mahesh told is very important. Actually, the judge and advocates are all laymen. Actually, they don't know anything about the medical world. If you convince them with all the records, what are the precautions you take it for in an OT? So usually, that itself is convincing to a judge. So otherwise, if you give a statement just like that, say, I have done everything correct, it won't work because they won't get convinced. So this is a very good idea to have a total protocol submitted to the court.
And one thing you should understand, the district commission, the judges are, one is a retired district court judge, the other two are laymen. They are qualified people, MA graduates only. So you should not expect too much from them also. So as Radharamanan sir said, they should, I mean, even a common man should be convinced with your evidence and the information you are putting forth in your favor.
So whenever you go, you take all the sterilization data, registers, that day, the list of people operated that day, the full register, everything, NABH protocol, what you follow, keep it big strong bundle, so everything will be safe. So that is regarding one. Documents and precedent judgments, that is important. I showed few cases. 98% of endophthalmitis judgments in Supreme Court are in favor of doctors. You can just get a lot of this thing. That also you can quote during your reply. This and this. So that is all you can do. Now second topic is trauma. This is very common scenario. So most of the judgments have come against the doctors because of lack of documentation, lack of imaging, lack of follow-up advice and lack of timely referral. Okay. So, for example, this case, Ravi Teja Visakhapatnam case against LVP, Visakhapatnam, they did primary repair and the next day patient was discharged in the morning, advised to come for scan on Thursday after 4 or 5 days. Patient did not come. Then he went to some other hospital and found that there is an intraorbital foreign body. And from there he went all around a lot of places and finally that eye became tricycle or something. So the initial thing, the court went against the doctor, say 15 lakhs was awarded. It is under appeal, that is another thing. But proper communication, when to call the patient, and just note that patient is advised B scan or CT scan before, next visit or something. Everything should be documented. Otherwise, this is another case. Patient had injury and emergency treatment was given and advised to go to the higher center. But the patient came after 1 or 2 days with endophthalmitis. Then he went to the higher center. But the doctor could prove that already patient came 2 days late to the hospital and he was referred, but he didn't go to the referral center early. So these things, if you properly documented and you have a referral letter and everything, patient, this case was dismissed. Another case was Abdul Jamal case, where the patient was treated and without doing a CT scan or B scan and was referred to Aravind Coimbatore. They found IOFB. The lapses were, there was no imaging, there was a delay in referral, and the most important, lack of documentation of, I told him to go to higher center, that is not enough. You should have documented it. So because of that expert opinion, the judgment went against. Another case where the IOFB was missed and the failure to detect IOFB was the cause for negligence, and case went against the doctor. So this is another one, bad injury, right eye injury with iron rod. They did everything, retina surgery, everything, vitreous hemorrhage, RD was there. And the case was dismissed because these are all possibilities that can happen with any injury. You can't give 100% vision in a retina detachment case after open glove injury. So, but luckily, it was all explained to the patient, written informed consent was there, this was dismissed. So, usual misses in ocular trauma, what all the misses, documentation, imaging, referral, any comments from Biju in medical college, what you have seen, experience?
Yeah, so documentation is very important, and as far as medical college setup specifically, one thing that we generally face is that, private hospital, I think you will be having the records in your EMR, you will be having that with you.
You will give it to the patient.
We have that OP ticket,
Okay.
and we probably will document it very meticulously in the OP ticket, and next time the patient comes there, that OP ticket is not there. So I think nowadays we are all sort of documenting it by keeping photographs, but it's also on an individual basis. So this thing is something which I find we need to evolve some sort of a protocol there. Another thing that we are in such potentially problematic cases, what I personally feel is that, and I advise the PGs also, that these patients can be admitted even for 1 day. Even if they go after that day, you can always write discharge against medical advice, but all those records will be there. So they will be having a record like that.
Otherwise, you will hand it over to the patient and they will, they will say, I didn't get anything.
Yeah, so many of these documentation in the OP ticket and they disappear sometimes.
I will tell one experience that we had a small corneal tear, small one suture under topical, one of the surgeons did, and discharged the patient, just like a cataract surgery. Next day, patient came with endophthalmitis. So, if possible, please admit any trauma for 24 hours at least. Right? Hello, sir. Yes.
That is another problem with this thing. Most of the injuries comes on the last patient. Most of them, they comes as the last patient also sometime.
No. This is a last patient on Saturday evening.
Yeah. So that is what, sometimes the injury must have happened 2 days before that thing.
Yeah.
So we also will have a lethargic time on that thing, and we tell that they have to come on next day, but we have to be like a documentation. I still remember one of the insurance case. It was not against us. When the insurance company was trying to deny it. And finally, this person has shown a photograph in their product. There's a lid tear, there is a small corneal wound, patient had this thing. And that photographer, the judge took it and this is a very serious injury because he cannot understand what is cornea, uvea and all. By looking at this thing, he was telling the insurance person, so you have to give some compensation. Because the photograph is always very impressive.
And one thing, Biju sir, like, normally in private hospitals and all our setups, we face patients who come with some injury. And later they say that it is they had some tussle with somebody or somebody hit them and they come for medical certificate and all that. And we in the first place have not informed the police also. Or how do you manage such situations and what is the protocol?
Just that for wound certificate and certificate. Police intimation. That also you can comment.
Comment, yeah.
The thing is that, we get the history from the patient. We are not detectives or anything, So that is not in our purview. So we take maximum care in order to get a proper history. And if the patient particularly denies that, that is not that we just document in the OP ticket that there is no MLC. Patient says there is no, he doesn't want any. For example, if it's an accidental fall or something, it's not an RTA, no case asked, told by the patient. So that is documented. That is all what we can do. Other than that, we cannot go after all these things.
There was a case where husband hit wife. Wife had a trauma. She said no case. After 1 year, it ended in a divorce and then she wanted a case.
Yeah, but it is documented.
So this is documented. We can't do anything. That is.
This usually happens actually. Most of the time they comes with some accidental thing, they will tell that. Only thing is, we have to write down properly what the patient tells. And next day or after some time, the police will come about, because they must have gone. Then I used to give it clearly. This is according to the history presented on this day. This is according to this clearly. But only thing is, you should be documented very well what the patient told in the initial this thing. So then it will act against him. That is, we will be a little more safer.
Another thing is, we can
as
actually,
alleged by the patient like that, you always write like that. The only thing is that, you always write it's an alleged history, as alleged by the patient. So that is what we write. And one thing is that, as Myers said, many of these patients come back telling that you need to actually, sort of modify this because now I want to go for a case. So that is sometimes we also try to sort of facilitate that and try to modify that. That I think is not very advisable.
I think we should not, if the patient comes and tells me about this thing, what I used to write it in the clearly in the case sheet. Now today patient is telling that it was an assault by this thing and that will be properly documented.
Also will be documented. I think we can record on our phone. Whenever we are counseling, I do bad cases or extremely difficult patients. There are some very difficult patients who will not listen to anything. So those cases I record in my phone. That also is, like they record our conversation and put it. So why can't we record?
I think video
very
consent
easy.
You can take. Video consent.
Video consent
You can take actually.
So that is admissible in
I
court.
do that now. My own phone.
So you always keep a copy of your reference letter.
Absolutely, absolutely. So these are some of the cases. Police intimation, many of the government hospitals is not a problem. Police will come and take the wound certificate book whenever they want. But in private hospitals, you have to do police intimation yourself. Take it to the police station nearby. Okay. Now coming to the third scenario is pediatric cases and ROP. It's a special group, pediatric, because many of the presentations will be delayed. There will be difficulty in examination, difficulty in documentation, and there could be a delay, especially in trauma case due to general anesthesia. A patient has come in the morning with the full biryani and then we will do it in the next day only. So, and poor communication. Many times whatever you tell may not enter the mother's head. So these are some of the cases. And plenty of cases are there regarding pediatric litigations. This was against Shankar Nethralaya way back. This happened in 2001 when we were there, 2000. So this, in spite of a good workup by a cardiologist and proper, patient had a cardiac arrest during anesthesia in a squint case, and the court findings were physician's failure to investigate murmur despite congenital anomalies, improper atropine timing. So just imagine what all court is looking at, the details, improper atropine timing, call in use, exacerbating, so these are all rushed surgery. The surgeon had 16 cases and this was the 16th case. Despite delay in schedule, the child was fasting from morning, record keeping inconsistencies. 1 crore was given against the hospital. So this is one other thing. Then ROP, I don't have to tell, tomorrow there is a session on ROP, you can attend that. The highest compensation in litigation is in ROP because it is a irreversible blindness that's happening in the child. And most of the ROP litigations are for not advising screening or not doing screening. It is not that you operate and still patient does not have vision. So that is the standard procedure. So be very careful about the standard. So anything regarding pediatric trauma, Jain and Ashok?
I think Jain has explained about 2,000 rupees and 20 lakhs.
Yeah.
When you consider the pediatric thing,
I think 1 crore is enough. 1 crore is, those doing pediatric cases here, please enhance to 1 crore at least.
Yeah, you have to take an enhanced PP scan, you get a protection of 1 crore. Yeah. Another thing is the child can take you to go up to till the child attains 18 years of age. Other cases there is a limitation period of 2 years. So, but in pediatric cases you have to be careful. The case can come up till the child becomes 18.
That is 20 years later patient can.
No, I think from 18 years limitation
Again
will start.
2 years. That means up to 20 years
18
the
years
child.
limitation will start, so 20 years.
Once the patient becomes major at 18 years, he understands that there is something, somebody screwed my eyes.
And one thing you have to understand, the Consumer Protection Act of 2019, they have specifically said that limitation period can be condoned in individual cases. They have specifically mentioned.
So it is 2 years is not
and
a
all
rule.
is like nothing. And second thing, there was a recent judgment in the Supreme Court where in PGI Chandigarh, a squint surgery somebody did. And after surgery, squint surgery was not working and the squint, not squint, total surgery.
Deteriorated.
Yeah, deteriorated. And the National Commission gave a verdict against the doctor, but the Supreme Court said that
I am discussing that tomorrow.
worsening of condition after surgery doesn't mean that surgery was done badly.
So
that is something
don't worry about endophthalmitis or loss of vision or eye become thumbsicle. Do it in a step-by-step, documented, timely manner and communicate properly. So the result is not the thing that will decide the judgment. So that is high compensation pediatric cases. Just last one scenario is intravitreal injections. Nowadays a lot of people are giving intravitreal injections and without any proper indication and proper follow-up. So and there are n number of cases against the doctors like giving Avastin because it is an off-label medication. Now there are guidelines saying that Avastin should not be used. Now there are a lot of other options available, so Avastin is not justified. So off-label versus approved, whether you need a fitness for injection, these are some of the points. Consent for each type of this thing and documentation. Any comments, Ashok?
Consent, now the new CPA 2019, they have said that not mentioning something is also negligence.
Yeah.
See, suppose you have said after intravitreal injection, you will not have retinal detachment. Suppose you are not mentioned in the consent. And the patient develops retinal detachment. So the patient will say, I didn't know that I will develop retinal detachment. If that was a complication, I would not have given. So, it is better in the consent to mention these are the possible effects.
All serious adverse events, even if it is rare.
Yeah, you please.
That is why if you see the AOS consent book, sympathetic ophthalmia is there in the consent. I thought we have never seen a sympathetic ophthalmia for past many years.
Yeah, like in medical college, Rekta Samardham, Rekta Sravam, Maranam Vare Sambhovikya. Like in medical college, all consents are like that only.
Yeah.
That is, the basis of that is this one actually.
So when somebody is using Avastin, little be careful. You take a proper consent for Avastin. What is off-label? All these things has to be mentioned because there are now alternative, cheaper Indian-made medicines. That is the thing. So this is any questions from the panel? I will wind up and give it over to Ashok Nataraj. He has a more legal side now. Any questions? Yeah.
About that fitness for injections, is it necessary?
That I didn't. Some people do. Now there are two situations. One is cardiac patient. Okay, cardiac patient. Some people blanket take consent from the cardiologist, but that is not the right method. I think I don't take consent for cardiac. But now there is a new threat that all these nephrologists are giving opinion against injections.
Yeah.
injection. They are telling it will worsen the kidney function. And
No, the point there is like there are a group of patients whose creatinine is high, but they have not gone in for dialysis.
dialysis. After your injection, if
They
it
go
goes
for dialysis, they say it is because of that. So in those patients, I generally now avoid anti-VEGF.
So, I give anti-VEGF even if the cardiac event, if the cardiac event was beyond 3 months or 6 months, I do give. But in the consent, it is written that very rarely it can cause this thing. In the consent, it is there. But I don't take, if the patient is too finicky, then I will tell you get a consent. But the problem is cardiologist doesn't know why we are asking the consent. They will write a patient is fit for surgery under local anesthesia, avoid globulate.
They are just.
That is the usual reply we get.
Yeah, they are just mentioning about the procedure only. They are
That's
not taking care of the, they are not even thinking about
But the
the.
anti-VEGF is creating a problem with nephrologists now.
Yeah, that is all. And even if you have to take consent, I think it's not required for every injection, is it? Like
The
if you have to
fitness,
give 3 injections.
Fitness.
Fitness.
No, only selected cases you can decide.
Yeah.
No, patient is very sick and, but in very sick patients already on globulate, nothing will happen. It is for healthy, some people that.
And for intravitreal injection, it is not necessary that you need to stop antiplatelet also. Even without antiplatelet, you can give.
Yeah.
For intravitreal injection, it doesn't matter.
So you don't need fitness, that is what I feel. There are some hospital policies. In our hospital, we don't take fitness for all.
But we haven't actually developed the correct protocols for this, whether fitness is needed. Suppose this goes to court. For any standard procedure, this thing is that you should have a consent. So wouldn't the court equate this is also a procedure, this with a consent? So if there's no consent, then you can be penalized, right? So is it safer to take a consent?
Fitness, you are talking about fitness.
Yeah.
Fitness.
Fitness and consent.
Fitness.
Consent is always a
Consent is
must.
always there. Okay.
Consent is always there. Fitness, it depends on in your hospital, probably the cardiologist or physician, either you can always send and get a fitness. But I don't know, each hospital has a policy. We take fitness if our so-and-so condition, we take fitness. It is written in your SOP, no problem.
Yeah,
That's
so-
what, each hospital can have their own protocol. If you say this was what we have been following for all the patients that is coming to the hospital, that is well and good.
So in our hospital, 3 months is the fitness duration. Yeah. After 3 months, again you have to take another new fitness, something like that. That is nothing standardized. It depends on your own.
Yeah, but in such cases, your hospital should have a standard protocol, which should be there. That SOP you should have in black and white.
Mahesh sir, one question. When you were talking about regarding taking the consent or any difficult cases and all, we are talking regarding that audio consent or the video consent. So how authentic it is? Like last day I had one case, one lady was totally thrashed by her autistic child with bilateral vitreous hemorrhage with lots of subconjunctival hemorrhage. You don't know who has beaten her, whether it is her kid or whether it is her husband. So according to how Radharaman sir have told, we have taken a consent. So the audio consent along with the video consent, and whether you need to record the eye condition and also that maybe some 2 to 3 years later we should not be in trouble. So how authentic is your recording the audio and video consent?
It is actually, if some patient comes back to you and said, not for this case, you are not told like that, then you can have this. I have told you all these things are there. I am not telling, but court can do a forensic evaluation and say whether you have tampered with your audio consent. Audio consent will add up to this. It is not a final this thing, right?
No, the records are supposed to be kept till 3 years. So you should keep these records also, even if it is audio and record.
No, it's not 3 years. Keep it for your lifetime.
Lifetime.
Because, I told you,
Just attach it to the EMR.
there is no limitation period. Even after 10 years, I will show you one case. Even after 10 years, they can give a case against you.
Because court is always sympathetic to the patient, not to the
Consumer
doctor.
court is for the patient, not for the
It's
doctor.
for the patient.
Yeah.
So you can always attach the audio, whatever you have described, to the EMR and then keep it.
So this is some case which I always tell you. This was a 52-year-old gentleman who comes to a doctor and he has got posterior uveitis. So differential diagnosis there was inflammatory posterior uveitis like VKH, posterior scleritis, or uveal effusion syndrome, or it is a very atypical CSR, multifocal CSR. Investigations were done. Uveitis workup was negative. FFA showed disc leak and pooling of dye in the posterior pole, stippled hyperfluorescence. Since there was vitritis, the doctor went in favor of inflammation and started him on oral steroids at 1 milligram per kilogram body weight. And there was slight improvement, vision improved from counting fingers 1 meter to 6 by 60. And even after 2 weeks, there were not full resolutions. The patient says he wants to go to some other hospital, he goes to a higher referral center. There again, they say the same differential diagnosis. They feel it could be an atypical CSR. And what happens is they stop steroids. But they tell the patient that, steroids have caused problems because it could be CSR also, so you could stop steroids. So that comes in the mind of the patient. And again, multiple PDTs were given for CSR, patient were treated for 6 months, nothing happens, and then finally in that referral hospital, patient undergoes vitrectomy with oil, the retina settles and finally regains a vision of 6/12. When this is going on, after the initial presentation in the other eye, patient develops the same condition. That is when the patient is in treatment on the second hospital. And in that eye, the patient has a worse prognosis. So this goes on for 10 years actually. So the initial doctor has treated the patient only for 2 weeks. So after 10 years, that is in 2020, this event started in 2010. In 2020, patient feels that it is because of the steroids that is started from the first doctor for 2 weeks that has created all this problem. And he gives a case for 13 crores in the National Consumer Forum. So the importance here is, you say you can give a case in the district forum, state forum, and national forum. Now we call it not forum, but commission in the new CPA rules. So here the important thing is, see, initially, where you have to give the case is based on the compensation you are asking. So if you're asking for 13 crores, you have to go to the National Commission. If it is less than 20 lakhs, you can go to the district. Between 20 and 1 crore, you can go to your state commission. But now it is not like that. It is depending on the amount you have spent for treatment. That is the basis on which, where you can give the case. So if it is less than 1 crore, it is in the district commission, district forum or commission, whatever. And between 1 and 10 crore you have spent on the treatment, then it is in the state forum. If it is more than 10 crore, it is in the national forum.
So patient has spent more than 1 crore, that's what he is telling.
No, now, before, that's the compensation he was acting.
Okay.
That is in CPA of 1986, Consumer Protection Act of 1986. I'm talking about CPA of 2019.
So
this case is given 2010.
For cataract surgery, some 2 lakhs, you can only go for the district count.
Yeah, district court, but the thing is, before, he can give a case only in the place where the cause of action has happened.
Yes.
But now it is not like that. Even in the patient's home also, suppose you are operating on a patient from Orissa, and he goes back to Orissa and thinks that I should give a case against you. He can give a court in the district, this thing in Orissa.
And you will be Aditi Toilali there, going every now and then.
And you have to go there. So that is the new thing in CPA 2019. So, okay. Now we will go to this. Now, see, the initial stand of Indian Medical Association always was, we did not come under the Consumer Protection Act of 2019 because nowhere it is mentioned. Initially, in the initial draft, it was mentioned health services. And the final draft, health services was removed from the CPA Act of 2019. So always IMA says that, we are not coming under that. So actually, it is not like that because only 2 things that are excluded from CPA Act of 2019. One is when the service is done completely free of charge. It is not that after all the damage you say, now you don't give me any money. So I am treating you free of charge. No, not like that. All patients should have been treated free. You are also treated free. Something happens, you cannot. That is one thing. Then the other thing is something called as contract of personal service and contract for personal service. See, contract for personal service is what we and the patient are having. It is like patient, gives you the responsibility of treating him and you are using your own judgment to treat the patient. So that doesn't come, that comes under the CPA Act of 2000. Contract of personal service means it's like a driver and a master relationship. The master says you go to Patrakal, then the driver will take you to Patrakal. You go to Tiruvambadi, then the driver. So it's like, so that kind of contract, it will not come under the Consumer Protection Act. So
in medical, only the first one, no?
Only first one. So because doctor is using his intelligence, no? Lot of things he is doing. So what I would suggest is when during cataract surgery, you tell, what surgery do you want? Then patient will say, I want phaco. How would you want me to do your phaco? Like this. Which lets you, everything you give. And try to make it into a contract of personal service rather than contract for, no, I'm just telling you it is something we can all try. And we cannot say to the court that, actually we are...
Do you want antibiotic?
No, I'm just telling you. Legally, I'm telling you. Are you, with what hand do you want me, right hand or left hand? Closed eyes, open eyes, anything you can say. Another important thing is there is something called the DK Gandhi case, which has come recently. What happened was a lawyer, one guy was employed by the lawyer for a check bouncing case. Okay. And finally, the lawyer won the case for the client. And the client did not have any money to pay. What the lawyer said, what did was, whatever compensation the court gave him, he took it and put it in his pocket. So the client gave a case in the consumer protection saying that the lawyer has fooled me. It is an act of negligence, whatever. Now the court in that has exempted lawyers from the Consumer Protection Act of 2019. And they have said, in addition, that doctors are also in the similar state. So in future, VP Shanta case has to be reconsidered by DK Gandhi. No, I'm just telling you. So something is, if IMA or KSOS or somebody can take it up and have a follow-up on that, probably, at some point of time, there is a chance that we can also. So they're saying is, doctors, it depends on whether it's a contract of personal service or contract for personal. So if you're giving your service, like a contract of personal service, where you give all the discretion to the patient, probably, you can get away with it.
So another thing is, in the records you can write, patient doesn't want to use gas, he wants only oil. Like that, everything you can write. I do write. A patient is not willing for oil, I put gas, then it will recur. You only told, I have written. So, something that we do in retinas, but not possible in cataract surgery.
Then limitation period, I said 2 years, but that doesn't matter. It can be condoned to any amount. Then why file a national commission? I told you right now, because of the... Then confusion of differential diagnosis, multiple diagnosis, and acting upon a particular diagnosis is not considered as negligence. So that you must understand.
Yeah, that is, different doctors may have different opinion based on different studies or research thing. For example, in DME, I give laser, one person is giving injection or something like that. So it is not negligence. It is, you should have a basic supportive evidence from literature.
Why you are doing.
Why you are doing.
Even
that.
in this particular case, one doctor feels it is atypical CSR. One doctor feels it is uveal effusion syndrome. Everyone is treating it in their own line, so that cannot be. Then error of judgment is not negligence, because you are doing it with your full knowledge and reason, and you are diagnosing something, and that is not considered to be negligence. And these are two tests, that Bolam's test and Bolito's test, that is usually applied to know whether actual negligence or lack of care has happened in that particular case. Mahesh sir, you can elaborate on Bolam's and Bolito's.
The one is, Bolam test is, the court will see whether there is standard of care. There is a standard of care in the management. Like, for example, ROP. The standard of care is you have to screen this many weeks till what time, what age. So that is a standard of care. If your patient has a contract with you, and if you have not done a standard of care, and if you have done something which a normal doctor would not have done, then it becomes a positive Bolam test, and you will be negligent. Bolito test is little more different. The court will apply its own method of evaluation of the evidences.
Like,
it is little more detailed. Actually,
journal evidence like that.
Yeah, joint evidence. They will have a separate medical board, and then they will assess the evidence again. That is what that case which I showed, that they did the whole records they did, and they found that the atropine was not given in time. These are all intricate dissection of the data. Supreme Court does all that.
Then last one is, how is compensation calculated? So now it has become totally different. Initially, like 1 lakh and all that Mahesh sir showed was long time before. They used something called as the multiplier method, where the annual average salary of an Indian is calculated and it is multiplied by how many years, whatever. So in the government records, it's still 10 rupees or 15 rupees. So even if you multiply it by 10,000 also, it will come only to 2 lakh. But now it is not like that. Lot of things, emotional injury, then whether the person was working, how much loss he has incurred, then court, lawyer fees, the financial, this thing, lot of things are considered, and they are like given a huge amount. You have the Kunal Saha case, where the award was, that is a maximum, there were around 7 crores, 6.1 to 7 crores compensation was given. with 6% interest from the beginning. That is, the case runs for around 10 years, 15 years.
That hospital is closed 10 years back. That is different.
Yeah,
In
so-
Calcutta,
so
Kunal's
that is-
case.
so that is why.
So here, suppose one child becomes blind, the child, what the child would have earned in his life, which was altered by your negligence. That means the father is a doctor, mother is an engineer, the child will be a graduate and he will earn this much money for 50 years and he would have earned this much. That is the compensation. That is how they calculate.
Yeah, it's difficult. So we'll go to the next case. It is a case of endophthalmitis, and it is a typical case. In an OT, on that particular day, around 5 surgeries are being done. And all patients, they develop endophthalmitis, and all these surgeries are done by different surgeons. So one person comes to an retina surgeon, vitrectomy is done, intravitreal is given. Initially vision improves to 6/12, but at the end of 1 month, 2 months, it's acanthamoeba end off and patient loses the eye and it's eviscerated. Now the patient gives a case against both the retina surgeon as well as the cataract surgeon. And now I will invite Dr. Vishnu to come on stage. He is kindly consented to be the Bakra for today. And we'll just enact a scene. How in the court, questions are asked and, how the doctor answers. So this will be a different thing. And this is not at all pre-planned. You can stand there also. It is not at all pre-planned. So it is just like you are a doctor, you are going there, questions will be how naturally a person is going to ask. And I'm very grateful for Dr. Vishnu. He's my very close friend and colleague. So in the court, so Vishnu sir, now you are the whatever,
Doctor.
accused, whatever. And I am for a time being, I am the lawyer. And he is my colleague lawyer. He will also intervene. And those 3 gentlemen there are the judges who will, District Commission, 3 people are there. Dr. Radharamanan sir will be designated as the retired district court judge. Remaining 2 people are eminent people in the panel. Okay. Fine. So, doctor, your name and credentials, please tell.
I am Dr. Vishnu Mohanam, MBBS MS DNB.
So, how many years have you been performing cataract surgeries, Vishnu?
For 5 years.
I mean, have you had patients developing similar complications and losing their eyesight in your career?
Yeah, I had a couple of cases.
So, this usually happens to you. Whenever you operate, patients lose their vision. Is it true?
It's not like that.
No. Just say yes or no. That is all I want to know.
Yes.
Yes. See, this is how you will be caught in the court. Anybody will have end off, no, in your lifetime. You will say yes. Then you will say, okay, now Arush, now you say this end off, then we will try to qualify. Then the lawyer will say, no. I don't qualify. Just say yes or no. Then you'll have to say yes, no, then finish.
There was, somebody was asked during the cross, this thing, how many bones are there in the body?
Yeah.
You know how many bones are there in the body? We don't remember. We are doing eye surgery. How many bones are there? So you don't even know that, and you are operating the patient, they will say. Okay.
Now, did you perform cataract surgery because you thought it was absolutely necessary, or patient could have gone even without cataract surgery?
It was necessary at that time. That was my thinking.
Okay. So cataract surgery was absolutely necessary to restore the patient's eyesight. Is it true?
Yes.
Does the lens become thicker once cataract is formed? Does it happen like that?
Yes.
What is the normal thickness of the average human lens, sir? Doctor, tell me. So you don't even know the normal average thickness. Now you have said that cataract lens thickens, and without that only you have diagnosed cataract. So how is it possible? You please qualify. Correct, no? This is how they ask. I mean, it is too much. Then the question is, have you employed all proper protocols in your OT?
Yes, I have applied all.
Okay. Now we have gone through records in your hospital. They found that you are not registered in the Clinical Establishment Act. Is it true or false?
It's not like we have registered.
You have registered, okay. Then can dust or dirt going to the eye after cataract surgery cause endophthalmitis, doctor?
Pardon?
Dust, dirt going to the eye immediately after cataract surgery, will it cause endophthalmitis?
It can cause.
It can cause endophthalmitis.
Yes.
Now, my client is saying that, you know, like you have promised my client that after surgery your eyes need not be covered with iPad and you could go home driving. Is it true?
Yes.
I have seen your advertisements also. It is true, no?
It's true.
Oh, so when he was driving, suppose dust has gone inside the eye. Can it cause endophthalmitis?
Yes, we have explained everything.
No.
The patient.
That is okay.
Yeah.
But if dust goes into the eye, you have only told him you can drive without iPad or anything. And now dust has gone into the eye. Can it cause endophthalmitis?
It can.
It can cause. That is fine. So my client says that after surgery you need not put an iPad. And without putting an iPad, can dust go inside the eye? Is it true?
It can.
And that can cause endophthalmitis?
That also can. cause.
See, so you have told about your patient, you have not taken proper precaution. You have told you can drive, you can jump, everything, and dust has gone in and my patient has developed endoff. See, negligence is proven, no? So this is, yes.
So after that, your advocate will try to help you. Some pacifying questions.
You are the advocate, you try to help him.
So Dr. Vishnu, you have operated 1,000 cases in 5 years.
Yes, sir.
Of that, except one or two, all 998 cases have got vision, right?
Yes.
Have you given antibiotic to the patient post-operatively?
Yes, we are giving it.
Given antibiotics.
Yes.
Do you have a consent form signed by the patient that endophthalmitis is a rare possibility in this thing?
Yes, we have a consent form.
So that is what.
mentioned.
So I think, respected jury, that he has taken all precautions and then signed a consent and explained to the patient. It is due to the patient's negligence that this has happened, not due to this thing.
Now the judgment is open to the jury. Now the jury can decide. Now only you can pass judgment. No one waiting for 6 months.
I think we have heard both sides, and the doctor has admitted that he has not given proper instruction to the patient, but he could have given more instructions, but he has taken regular, normal precautions in operating and taking all the antibiotics, everything he has taken. So this cannot be considered as a negligence from the doctor's side. So he can be accepted.
Yeah. So now the option is the complainant can go for an appeal to the higher court. See, initially the appeal was you just have to pay 25,000 or half of the amount decreed. Now it is not like that. Whatever amount has been decreed by the court, 50% has to be deposited. Then only you can go for appeal. Suppose 1 crore has been, decreed by the court against you. Just to go for appeal, you have to pay 50 lakhs.
That is if the judgment is against the doctor. So now you are...
No, anyway they'll go for, anyway anybody can go for
If the
appeal.
court case is dismissed by the district court, the patient doesn't have to...
No, dismissal is different. Dismissal means...
Now the patient...
The case
complainant can go to the...
now the patient can go to the next higher court. He can go to the state commission for appeal.
He doesn't have to pay anything. But if the judgment is against the doctor and you have to go for an appeal in a state forum, you have to have, if they say that 5 lakhs or 10 lakhs, half of it you have to keep
Pay
as court fee.
for this thing. That's what.
Another question is, suppose there is a purposefully defaming a doctor or hospital, purposeful, and that is established in the court, whether the doctor can go against the patient.
Yeah, that is a totally different thing. That's a defamation suit. But the problem with defamation suit is you are claiming 10 crores, you have to pay 10% of that in the civil court. Then only you can go for a case.
I will also answer. Actually, defamation you can file in the court, they may not admit it at all. Okay, because you have to give enough evidence that because of this, patient's defamation, I lost my practice, now I am having so much loss, then the court may admit. And if you can't ask crores and all. You can,
but 10% you have to put.
So I literally went against a patient to admit, file a defamation case, but these were the problems. I just dropped it later.
Okay, I think time is over now.
Any comments? We'll have, few interesting.
Yes, interesting comments.
Yeah.
Lawyer
tells you to answer yes or no, are we obligated to answer only yes or no, or I can qualify with a couple
No,
of
you can
sentences?
qualify, but the lawyer will say, doctor, I told you only yes or no. Or you can probably keep quiet. That is the one option you have.
No, because if the questions are put in such a way that this yes or no.
You
can
look
be-
at the judge and tell that, sir, respected your honor, this cannot be answered in yes or no because it requires an explanation. Please allow me to give the explanation.
Yes.
Mostly,
The judges intervene.
in our court, most of the lawyers are also very bad in English. Suppose you talk in a good English, looking at the judge, you will allow.
Okay.
This is another small trick.
I think this thing happened many times to me, and 100% of the times judge allowed.
Judge will allow you. You can give an explanation. Yeah. Madam.
How many?
Madam, that nowadays the studies show that you don't need preoperative antibiotics, even though some judgments are there that without giving antibiotics they operated. You can, your hospital policy is enough, madam. Whatever you have written in your SOP, that is enough. If I give it for 2 weeks only because it can cause resistance, that is enough. That is our hospital policy. You have operated thousands of cases without any complication, that is it. So, there is no strict, another thing is how many cases you can do in a day. This was a big issue. Srinivas telling, AOS has told this many. But the problem is, suppose the 16th case has a death or endophthalmitis, like this Shankar Nathralaya case, there will be this thing. So, AOS says 30 cases or something, no?
So, yeah.
Something like that. Yeah?
I just have a last question. What if that case of 13 crores and you don't have money to pay and all your legal documents have been given to them, all summed together, it's not coming up to 13 crores, and what do you do next?
Bankruptcy.
File for bankruptcy.
Bankruptcy.
Yeah, that's possible, no? File for bankruptcy. Before that, shift all your FDs into some charitable society and then something like that.
You have got an insurance, right?
Yeah, insurance is there. They will. But 13 crore and all, nobody
13
covers.
crores is nobody covers.
Mahesh, just because the patient demands 13 crores doesn't
It doesn't mean
that's what-
anything.
Now, currently, the
Patient can
highest
demand anything, no?
highest is 7 crores in that Kunal Saha
That is
case.
because death
That
has
was a
happened and that is gross negligence also. So that's
No,
different.
like she was worried about the 13 crores.
No, don't worry. It's okay.
Okay,
Sir,
so,
the last, sir, that ROP, then you have to keep it for 20 years.
yeah.
20 years.
What is the problem? You have EMR, no? It will be lying in the cloud, no problem. That's why all of you changed to EMR.
I think for anything you keep it as long as possible.
Because
That's
the other
not
one will
out of
get,
the-
after 4 or 5 years, it will get crumbled and chedalerikum.
No, because you can't, when patient comes with the case against you, you don't know what is only happening. And you can't say to the court that I am supposed to keep only for 3 years. Nobody will allow it.
We can take our EMR, but once you are going to multiple hospitals and all, you never know how they are keeping it. That's what.
Okay, thank you very much for all the cooperation. Thank you.